How to manage radiation proctitis side effects. Have you or someone you know experienced radiation proctitis after prostate cancer treatment? This condition can be uncomfortable, but there are effective ways to manage its side effects. Radiation proctitis is inflammation of the rectum caused by radiation therapy. Symptoms can vary from mild irritation to more severe issues like bleeding and pain. For many, the first step in managing these side effects involves supportive medical treatments. Staying well hydrated is crucial. It helps maintain fluid balance, which can be beneficial during recovery. Antidiarrheal medications can also help control bowel frequency, making daily life more manageable. Topical therapies, such as steroid or 5-aminosalicylic acid enemas, can reduce inflammation and promote healing in the rectal area. Pain management is equally important, as it can significantly improve comfort during this time. If symptoms persist or become more severe, additional interventions may be necessary. For example, endoscopic treatments like argon plasma coagulation can be effective for controlling bleeding. This procedure cauterizes bleeding vessels in the rectum, helping to reduce hemorrhage. Another option is the application of formalin, which can help control bleeding by sealing tissues. These procedures are generally safe when performed by experienced healthcare professionals. In rare cases, surgery might be considered, especially if there is extensive tissue damage or persistent bleeding that does not respond to other treatments. However, surgery carries higher risks and is usually a last resort. Preventive measures during radiation therapy can also help minimize the risk of developing radiation proctitis. Techniques such as precise targeting of radiation beams can reduce exposure to the rectum. Positioning the patient strategically during treatment can further lower the rectal dose. In some cases, protective materials like collagen spacers can be injected to physically separate the prostate from the rectum, reducing the likelihood of damage. Ongoing monitoring by healthcare providers is essential. Patients should report any new or worsening symptoms to their medical team promptly. This allows for timely management and adjustments to treatment plans. Each person's experience with radiation proctitis can differ, so personalized care is key. In summary, managing radiation proctitis side effects involves supportive care, endoscopic treatments for bleeding, and preventive strategies during radiation therapy. Close follow-up with healthcare professionals ensures that treatment is tailored to individual needs. Always consult your oncology and gastroenterology teams for the best advice and management strategies.